speaker. It will go down in our annals and our history that you are the first speaker to actually speak on this bi-monthly webinar. In the last couple of days, we'll be extremely busy. We started on Saturday with No Tobacco Day, championed by the youth arm of Nigerian Cancer Society, the Youth Coalition Against Cancer. We had a very super outing here in Abuja and also all the 33 states across the country. The minister was there, be part of the program. And on Wednesday, we'll be at the Ministry of Youth Development to sign a formal MOU with the ministry and also decorate the minister as our youth ambassador. I must sincerely thank Her Excellency because I met the minister when I paid a costly visit to Her Excellency in Ibadan. And since then, we'll be carrying on. Very, very supportive, giving us all the required support to ensure that the youth arm is well supported. Well, we're here this evening to wrap up the National Survivor Day celebration in Nigeria. It's not a new celebration. It's something that has been on many countries for many years. But this year, we appear to get it right in our country, particularly NCS throwing its support to this program. We have a national coalition to mark the event. We started on Friday to kick off the program at Muyo, Akwa Ibom State, where my vice president was there. We also have outreaches there, collaboration with Only Belief Foundation, Care Foundation. Yesterday, we have 2 virtual lectures, one at Akwa Ibom, and the Atinuke Cancer Foundation also organized one in collaboration with us. But today is the grand finale, where we wrap up the celebration. But we must remind ourselves, that this program is specifically set aside, for us to dedicate ourselves, to all the plight of the survivors. In the Nigerian society in the past, we not pay serious attention to survivors. We take decisions without their input, and we think that is not too correct. But what we've done when we came on board is to involve the survivor in all our governance structure. The board of trustees that will be constituted very soon, and we will have minimum of 3 survivors there. Because then the National Intervention Fund, I'm happy some of the states, we have survivor as the chairperson, as the secretary, and the Youth Coalition, coordinator for Northeast is a cancer survivor. So we'll continue to involve, survivor at all levels of our decision, because if you have not gone through the process, honestly speaking, what you'll be discussing about is just textbook stuff, probably what you are taught in the classroom. The real teacher that can tell us about cancer are the survivor. And we must congratulate every one of them because the journey is a very hectic one. Many started the journey, and many of them are not alive today. The cost of treatment is something else. Some people, they are picked very late, advanced stage, or stage of the disease. They have no access to resources, and access to prompt treatment is also a challenge. Those that have the resources, the effect of chemotherapy or radiation, or misdiagnosis, or whatever issue, may lead to death, and they know to make the journey. But some people, despite the go of chemotherapy, side effect of radiation, surgery, complication here and there, they still survive the entire treatment process. They get stabilized and they are survivor. So there is it for us to celebrate, and also they are resilient, also going to support their hope, and also ensure that whatever we need to do, we give them all the needed support. Not only the survivor, of course, the role of caregivers is very important, and family. Some people die because they have no family support. Some people die because they have they're unable to handle the face of denial. Before they are depressed, and when they commit suicide. But we have some of our members, that they've handled denial, handle loneliness, came out of it, and they are strong, and they are, keep going. Our Excellency, for example, is almost 30 years, survivor, a very good one. Anywhere I go, I use it as a point of reference to people that if Our Excellency can fight it, 30 years, stay counting, that you can also, overcome. I remember being part of work, caught a couple of times. Even Her Excellency, the kind of strength she has, even the youth, we try to catch up with her, during her work in Ibadan, to tell you that it's not only that she's alive, she's very strong, and also very healthy. And that's kind of thing we pray for our survivor, for them to be very strong, and healthy. So without wasting much of our time, we have a keynote speaker, is someone that we all know. Our life is a testimony to when it comes about survival, and that's why we carefully invited her to come and speak to us, share experience with us, because we believe that many of our survivors have a lot to learn, from our testimony. So once again, thank you very much for joining this webinar. And because of this program, we'll also be unveiling our new coalition. One issue we've had in the country is that we find it difficult to organize a national coalition. There are various individuals and groups that are attempted to form one, but we think that this should be the time where NCS should provide direction, when it comes to this coalition. We've done enough consultation behind the scene, and we are bringing people that are very neutral, very neutral. They have no private NGO, they have no interest. There are people that we think can, help us develop structure. And of course, we're going to have advisory board. So we just announced the ESCO, the chair, national chair, the secretary, the assistant. We'll announce the others later, and the advisory committee that will be over it. We will give all support to this coalition because we think that this coalition is extremely very important. Moreover, we're about setting out a separate fund, National Cancer Intervention Fund. Very ambitious one, you may say, exploring to get 100 billion, in the next 5 years. But we'll begin to see light, in the tunnel. Some banks have started keen to it. We have farmers that are keen to it. At the webinar yesterday, a billionaire, was there, and I discussed that, and he said I should see him that's interested in supporting, and also asking his friends also part of it, because he actually had multiple myeloma, and they have spent millions of naira, to be alive. And he said, yes, everything I've said, 100%, that survivors need to be supported. So we begin to see support even ahead of the launch. And we hope that we put together very, honest and, men and women of integrity that manage the fund. In my interest to know that your president, I'm not a member of that, governing council. It's very, very dependent, people of track record. We are bringing in experts, that can manage the fund. Not the NCS will manage. We are not managing, there are standard people that manage fund in the country. System spec, for example, have shown interest, remitter, we're going to contact Flutterwave, and those are standard people that can manage fund. Because our expectation is that the various lapses we have seen in the current one being operated by federal government, we'll use that one as a prototype, that things can work in this country. And once again, thank you for joining. During the course of the meeting, we're going to discuss, some of the other things we are trying to do. Thank you very much. I must sincerely thank Oncopadi for partnering with NCS. They provided this platform, very free, free of charge, and it will be a continuous program, bi-monthly for now, and then subsequently we might migrate to monthly, meetings. It is a platform for us to come together to discuss and bring in speakers of great repute, to discuss, contemporary issues that will be of benefit to all of us. Thank you everyone for joining, and I wish everyone a very, very educative and fruitful meeting. Thanks, and over.
Thank you very much, sir, for that welcome. I believe everyone here felt very warm with the message that you have shared and telling us all about the National Cancer Survivors Day and all that has been going on so far. Moving on to the next thing on our agenda, I will be inviting a consultant clinical oncologist, founder of Oncopadi, Shebekli, and Pearl Oncology. Please, we'll be inviting Dr. Omolola Salako to speak to us on digital tools for cancer survivorship. Welcome, ma.
Good evening, distinguished participants, the President of the Nigerian Cancer Society, and our keynote lecturer, Her Excellency, Dr. Mrs. Betsy Akeredu. I'm delighted to very quickly talk about the digital tools we have built over the past 7 years at Oncopadi for cancer survivors, for cancer patients, and in the past 7 years of building various products. We have gathered a lot of evidence. We have learned a lot of, success. We have a lot of success stories. We also have many challenges that remain unresolved. And I hope that as we share this experience with you, we're able to inspire you to serve your patients better and to understand how our tools work, because we want more people to collaborate with us. Oncopadi is a digital health innovation company with a slogan accelerating the e-patient movement. And this is because whilst we know that there are patients who walk into the clinic physically, receive chemotherapy, consultations physically, there are also many patients who make decisions online, who would Google what's the cure for cancer, what's the best hospital. And if we want more cancer survivors in Nigeria, we have to see technology as a low-hanging fruit. We have to build products that are elegant, that are beautiful, that suit our language, that make our patients, comfortable, that help the caregivers to make decisions. And as I run through this, I would share some of our stories. I'm really grateful to the Nigerian Cancer Society president and the EXCOs for partnering with Oncopadi to launch this premier edition of the NCS and Oncopadi bi-monthly webinar. And basically, as we premiere today, the goal is really to highlight how various stakeholders over the last decades have been supporting cancer patients. We know that cancer survivorship, there are various definitions of cancer survivorship, but the common one is from the moment of diagnosis all through the person's lifetime. At the end of the day, some people want to say survivorship is at the end of treatment, but honestly, in life, when we are faced with obstacles, the minute you make up your mind to face it, you're already a survivor. And we know that survivors go through many challenges that cut across physical, treatment side effects, mental, overwhelm, stress. There are many negative emotions associated with survivorship. But our mantra at Oncopadi is to give the patient or the caregiver a tool that is already in their hand, like their mobile phone, to make decisions to help calm them down. Next slide, please. And over the years, for me, as a professional, my journey started more than 2 decades ago when my younger sister was diagnosed with kidney cancer and she died within 3 months. And so within 3 months, I remember sitting at the laptop in the United Kingdom and just typing, how do we cure this cancer? How do we, what are the clinical trials? And as far back as, 2003, technology has been there answering questions for us. But the sad thing in Nigeria is we haven't populated enough information that answer the questions of our cancer patients. About 3 years ago, Google ranked cancer as one of the most searched words worldwide. And so as cancer stakeholders, how are we integrating patient education in our hospitals, in our NGOs? When patients go home, imagine this is 7 p.m. Most patients are back at home. They've heard all types of things by the oncologist, by the nurses. What information is available that breaks down that complex information, that reminds them of what the doctor said or the oncologist said? How are we using technology to de-escalate fear in cancer patients? And that's the journey Oncopadi has been on. Next slide. Next slide. And so the first thing is to really gather evidence, and that's where Oncopadi, started from and continues to sit at. Because the way Nigerian cancer patients use the internet, we expect it to be completely different from how Europeans or Asians will use the internet. And so we have started very strongly with a research pillar that allows us to understand the digital health needs of our cancer patients. We know what time cancer patients like to use the internet. At some point, we conducted research that confirmed, are you using Google or WhatsApp to source your information? Where are you getting your digital health information from? How much would you pay to use an app? How many cancer patients are reporting their side effects on our app 3 times a week? And over the years, we've published many of our papers. Most recently, we published a systematic review on the African continent that highlights the common side effects cancer patients are experiencing. And fatigue is the most common side effect that cancer patients experience. Now, this is a side effect that many clinicians underestimate because it is not dramatic. It is not like someone vomiting, it's not like someone having diarrhea, but fatigue is something that the person just feels very tired. And so we will continue to collaborate with researchers in hospitals, NGO setting. As long as you're involved in taking care of cancer patients, we would like to work with you to continue to assess the best way we can help our cancer patients digitally, and then generate evidence on how patients and survivors are using the app in Africa. Next slide, please. The second thing is around tele-oncology, and this was something we started within year 1, and it peaked in 2020 during the COVID pandemic. It was a situation where opportunity met preparedness. We had developed the second version of the Oncopadi app. We had a mobile app, we had a web application, and then the COVID pandemic hit, and everyone was locked out and locked down. And I remember in that season of lockdown, I must have conducted about 40 consultations virtually every month. And these were services patients were paying for because what they needed was information, counseling. This was a time where people could reach out and join their online support group. So very quickly, we converted our physical support group to a virtual support group. And very quickly, we identified patients who had symptoms, put them on a virtual consultation. If they had an emergency and they really needed to go to the hospital, we would write an e-medical report, send it to their email, and when they're on the road, they have an email, a medical report to flash to the law enforcement agencies. Of course, we pray that there will be no such pandemics, but we just have to incorporate telemedicine virtual consultations into our services. Now, telemedicine is not the solution for cancer care. It's not the strongest pillar, but it is important we are there for our patients when they need us. Because most times when patients have
Good evening. I think we are having some network issues. Let's please give 1 or 2 minutes. Dr. Salako? She'll soon be with us. Let's please give 1 to 2 minutes.
I apologize, I'm back.
All right, ma'am.
So sometimes patients have severe side effects simply because they didn't get the information to drink the ORS solution, or they didn't get the information to use the tablet after every loose stool. And then the patient presents to the hospital 4 days after chemotherapy, severely dehydrated, severely malnourished. And if only they had drank ORS, which is maybe 500 naira, if they had taken the loperamide tablet, which is maybe another 500 naira, that's 1,000 naira. They probably will present to the hospital with moderate or mild side effects rather than presenting in severe side effects where they would then spend hundreds of thousands of naira. So over the years, Oncopadi has conducted more than 4,000 virtual consultations across 8 countries, with many people being the caregivers of cancer patients. And so a lot of caregivers in Nigeria and in diaspora are sourcing for help. And sometimes they just want an independent, calm, non-clinical pathway to getting clinical information. Next slide, please. Next slide. Now, the third thing I would like to talk to you about is the patient education and resources. Again, I've touched on this, and over the years, we've recorded several videos because videos are very appealing. A lot of patients and survivors sometimes don't have the luxury of reading through very long text. So sometimes you want to engage them with, visuals, color, explanations, and sometimes you have to get videographers who have some experience in healthcare, or you're a healthcare professional who has experience in storytelling. And at the end of the day, it's always about a multidisciplinary approach between healthcare professionals and non-healthcare professionals. Every time they talk about MDT, people focus on the surgeon, the oncologist, the radiologist. But if we want to deliver excellent cancer survivorship services in Nigeria, we have to expand our brains, our thinking to include every other person who gets the message out there: our journalists, our storytellers, our content creators, our videographers. We may know everything intellectually, but if we don't have a strategy that sends the message out, that calms the patients down and sort of ushers them in calmly. A lot of times, some patients will say, when I walk into the hospital, I don't like the smell of Izal, all the antiseptic agents they use. So it's important that we create educational content for our survivors, and not just content that focuses on treatment. It should also be content that focuses on decades and decades after treatment. And so we've worked a lot with different organizations. We've worked with Microsoft to develop some cancer coaching videos, and several pharmaceutical Next slide, please. Next slide, please. Are you there, Modupe?
Yes, ma'am.
Okay, something unique we did, and this was also in 2020, towards the end of 2020, we thought to ourselves, there are several hospitals in Nigeria that cancer patients go to, and they do not have the complete set of oncologists. It will take us another decade to fix that because it's a national crisis. So I'm still on the digital hub, please. And so in a state like Kogi and 17 other states in Nigeria, there are no clinical oncologists. Because there are less than 100 oncologists in the country, we know where they are positioned. So a state like Ogun State, we set up a digital hub. Please, can you take me to the slide on the digital hub? Thank you. And so we set up a digital hub that was clinically oriented, and we conducted 2 programs there. The first was we set up a physical space where cancer patients could walk into, and virtual oncologists will be on duty to collaborate with the surgeons and the medical officers who were caring for those patients. And in the pilot, we cared for about 30 cancer patients using the physical digital hub. So oncologists from various states, Lagos State, Oyo State, were virtually consulting patients in Ogun State, with the patients sitting in the hub that we commissioned, while the virtual oncologist was dialing in from any country and from any state. And that's still a model that we have to explore. Yes, we know we don't have enough oncologists, but we can transfer knowledge in a time-bound approach. For example, every week, give 3 hours of your time to 6 hospitals here, there, and everywhere. And of course, it has to be a sustainable project. It's not going to be a free of charge project. Someone has to fund it, whether it's the patient, whether it's a donor, or whether it's the hospital. The second thing we did in College of Medicine, University of Lagos, where I'm a senior lecturer, is we created a research hub. And so there's a strong research pillar to everything that we do. We must generate evidence and document it. Next slide. And in that picture is where we were commissioning with the Honorable Commissioner of Health, Ogun State, Dr. Tomi Koka. Now, moving into capacity building, we've developed the first online course that allows primary care physicians and cancer specialists to collaborate. Sometimes primary care physicians see our cancer patient and their WBC is 20,000 and they think it's an infection. But no, it's not an infection. We gave a granulocyte stimulating factor to stimulate the white blood cell production. And so we have a lot of misalignment with how we care for our patients in the community. If we're able to appreciate the relevance of other medical professionals who can collaborate better with our cancer specialists, then we would win this war against cancer, because community work and community workers are integral to diagnosing and following up our survivors. Now, we created this online course. It has 5 modules. We had an international faculty, some local oncologists, some international oncologists, some local primary care physicians, international primary care physicians. We've trained, next slide, please. We've trained 50 healthcare professionals, a mix of nurses, doctors, primary care physicians, surgeons, clinical oncologists. And for the first time in Nigeria, we have the first cohort of cancer specialists and primary care physicians that have worked together. We've done our pre-test and post-test, and the results are looking very good. We'll be presenting that data, hopefully at the Aortic conference. Next slide. And I'm coming to the end of my slides. Next slide, please. Now, Modupe is going to talk about this later. BRANT stands for Breast Cancer Access, Navigation, and Testing. There are 3 pillars. We provide access to supportive care. The BRANT program is a program for breast cancer patients. We want to support 5,000 breast cancer patients, and they have access to free immunohistochemistry testing. They have access to counseling by a psychologist, counseling by a dietitian, and the dietary consultation is becoming very popular amongst our BRANT beneficiaries. But most importantly, they have access to immunohistochemistry testing. And this is a program we are really glad to partner with the Nigerian Cancer Society, as well as we're grateful to Roche for funding the program. Next slide. And so I have presented some of the products we have built. And many people ask the question around BRANT, and they say it's digital. What if people don't have access to the internet? The BRANT program is hybrid. Most of our beneficiaries are reaching us via emails as well as telephone calls and WhatsApp. On that note, I say thank you for listening.
Thank you very, very much, Dr. Salako. You've taken us through the wonderful world of tech. I don't know if I'm audible. I want to, as we proceed, apologize for joining this, joining the house very late. I did everything I could, ensured I had like 3-4 alternatives to internet, and then when it was time, literally all of them just crashed. I really apologize for joining late, and I thank you, Modupe, for firing on all cylinders, even in my absence. Thank you very much, and welcome. I want to welcome everyone again to this forum. It's going to be a bi-monthly forum, so it's something that will be happening many more times as we go along, God helping us. Today is a special day, so we would want to run quickly to one of the major reasons why we are gathered. We know This event is mainly to help us mark part of the activities for the for our survivors that have been going on over the past 2-3 days within the NCS, within the cancer space in the country. So we are going to have the much sought after, much awaited keynote lecture from well, I don't think I am that strong enough to actually read her citation or talk about her. I must say, I always say that whenever I have to introduce her in public, I shiver a little bit. So thankfully, there's somebody that is in a much better position to do it, and I believe he's on this platform. Mr. Promise Iheze, I hope you are here. Please, I'm just going to give you the next 3 to 5 minutes to talk a little about our keynote lecturer for today, Dr. Betty Anyanwu Akeredolu. Promise is the COO, he's the Chief Operating Officer of Brecan. So if there's anybody that can talk about her, at least to us, and introduce her, it should be Promise. Promise, I hope you're online.
Yes, I am. Good evening.
Please, you have the floor for the next 3 to 5 minutes to introduce our keynote speaker before she takes the lecture.
Thank you so much, Dr. Tene. Can you hear me?
Very well. You are very audible. Thank you.
Thank you very much. So it's my pleasure to introduce my boss. It's going to be a very short introduction. Dr. Betty Anyanwu Akeredolu is a seasoned aquaculturist and researcher with specialized expertise in the application of solar energy in fish production, which she has demonstrated through her work at Aquatech Farms, Aquatech Farm Ventures Ibenia in Owo, Ondo State, and also at Red Brick Hatchery, Jericho, Ibadan, Oyo State. She is also a distinguished public health advocate with strong commitments to birth registration, water sanitation, and breast cancer awareness. She is a breast cancer survivor of 28 years and counting. And Dr. Betty Anyanwu Akeredolu founded the Breast Cancer Association of Nigeria, BRECAN, in 1997. That was after surviving breast cancer. And with the vision to create awareness, support patients, advocate for better health systems, and promote research in the fight against breast cancer. And recently that has been expanded to also include cervical and prostate cancers. Her story has inspired thousands, and her work continues to be a beacon of hope in Nigeria's public health landscape, especially in the fight against cancer. Dr. Anyanwu Akeredolu is a passionate advocate for girl-child education and actively champions the inclusion of women in science, technology, engineering, mathematics, and entrepreneurship. She is a respected voice in Nigerian politics. She has played a pivotal role in promoting unity and enhancing women's participation in governance. She served as the First Lady of Ondo State from 2017 to 2023, using her platform to amplify issues of health, education, and women's empowerment. Ladies and gentlemen, I present to you Dr. Betty Anyanwu Akeredolu, the former First Lady of Ondo State and the founder of the Breast Cancer Association of Nigeria. Thank you.
Thank you very much, Mr. Promise. Your Excellency, you have the floor, ma'am.
Thank you. Thank you very much. And good evening to all present on this call. Before I start, I have a special thanks to Nigerian Cancer Society, ably led by Professor Omonusi. You have done well for us, the cancer survivors. What you have put together has watered the ground for a coalition we so longed over the years. I can tell you that cancer survivors in this country, although we're doing our own bit, we've been operating in silos. But now, I believe henceforth, we will be operating with one voice. So I thought I should mention that. So distinguished colleagues, partners in the cancer space, survivors, advocates, and friends, it is with profound gratitude and hope that I address us today as we mark the 2025 National Cancer Survivors Day, an occasion that recognizes not just survival, but the strength, resilience, and enduring spirit of individuals who have faced the storm of cancer and emerged victorious. This year's theme, Celebrating Life, Raising Awareness, and Inspiring Hope for the Future, resonate with me, not only as a survivor of 28 years and still counting, but as someone who has dedicated her life to ensuring that cancer is no longer a death sentence in Nigeria. In 1997, after overcoming breast cancer, with the goal of creating awareness, supporting patients, carrying out results-driven advocacy, and promoting research in order to stem the tide of needless and preventable deaths from breast cancer. And in recent years at BRECAN, we have expanded the scope of our operation to include cervical and prostate cancers. When I began this journey 28 years ago, I was like a lone voice crying in the wilderness. The stigma was so high, misconceptions all over the place. Patients suffered and died secretly, while those who survived were too shy to share their stories. That shame broke through the barriers of stigma and announced my status, choosing to speak over silence. Today, I'm no longer an isolated voice. Our fold has expanded tremendously. During the last International Cancer Week in Abuja, I saw a lot of survivors, young and not so young, telling their stories and being celebrated. It gladdened my heart. Today is an event and another win for patients and survivors. A very important assurance that we are not alone in this fight. Defeating cancer calls for a multifaceted approach where caregivers, researchers, patients, advocates, survivors, family, and most importantly, the government must join hands, pool resources, and fight in one accord. Let's take a look at today's theme, celebrating life. Celebrating life is a powerful act of resistance against the silence, stigma, and fear that too often surround cancer. Every survivor's story is unique and a testament to medical progress, the power of early detection, and above all, the indomitable human spirit. As we celebrate, we must also remember those who did not make it. We can only honor their memory by pressing on in this fight. We can only honor their memory by pressing on in this fight. Among those who did not make it, we find those who presented at very late stages, those who presented early but could not afford the cost of treatment, and those who may not have had access to the right information. These issues are the talking points that provide the direction for our movement. Raising awareness. Raising awareness remains a critical task. I've always said it time and time again. The entry point to surviving cancer is information. If you don't have information or the right information, you will never understand what you're dealing with. Too many Nigerians are still unaware of the signs and symptoms of common cancers. Too many still believe in myths that delay diagnosis and treatment. At Brecan, our goal from inception has always been to bring breast cancer and now cervical and prostate cancer out of the shadows. Through grassroots education, community mobilization, and advocacy, we strive to ensure that no one faces cancer alone and uninformed. To us, access to the right information is also a fundamental human right. Inspiring hope for the future. Inspiring hope for the future means pushing for a Nigeria where cancer care is accessible, affordable, and compassionate. It means strengthening policies, equipping our health institutions, and building survival networks that serve as lifelines for newly diagnosed patients. Hope also lies in the power of collaboration. Together, as survivors, caregivers, healthcare workers, policymakers, and advocates, we can create a future where being diagnosed with cancer is no longer a tragedy, but a treatable reality. Government at all levels must realize the urgent need to create budget lines for cancer. Investments in cancer care must be all-inclusive, data-driven, and results-oriented. Existing cancer centers must be upgraded and fully equipped, while new ones must be built to complement the efforts of the existing ones. The investment in cancer care must equally prioritize awareness creation. The message of prevention and early detection must be taken to every nook and cranny of this country. NGOs must leverage on partnerships and do more. In conclusion, I once again thank the Nigerian Cancer Society for organizing this important event and for their unwavering commitment to the cause. To all my fellow survivors, your lives inspire, your voices matter, and your journeys give meaning to our collective struggle. To the patients, never ever lose hope. And that's why this coalition for cancer survivors is very, very important. It's imperative that we get it done and sustain it, because it's only when they see people like us that they thought that cancer is a death sentence flies through the window. To our fallen heroes, your memories will inspire us to more action, at least to say that you didn't die in vain. To the government, the healthcare givers, the advocates, friends and families, we are counting on your sincere efforts. So, as we celebrate, we must also renew our commitment to awareness, to equity, and to ensuring that the future of cancer care in Nigeria is one defined by hope, dignity, and survivorship. Thank you all for listening.
Thank you very much, Her Excellency, Dr. Betty Anyanwu. Thank you for the keynote speech that you just gave. You reminded us that everyone has a role to play in raising awareness. After this keynote speech, I would like to say that there will be no questions, but we are still so grateful for what you just shared with us, Ma. We'll now be moving on to the next thing on our agenda, which is having a special address by Dr. Isiaq Adekunle Salako, Honorable Minister of State Health and Social Welfare. I would like to ask if he is on the call or if we have a representative.
You can skip that. I'm still trying to catch up with his special advisor. Let's skip that. Dr. Oche is here, but I'm not sure he has the mandate of the minister to speak. He's here in his own capacity to address us.
Okay. Thank you very much, Mr. President, sir. I think if we are skipping that, then we are proceeding straight to goodwill messages.
Excellent.
I would want to call on, now let's just be very clear, the people that are going to give us goodwill messages, we didn't arrange them in any particular order of importance before we start looking at whether we are ascending or descending, please. So I want to call on Mrs. Eunice Oreka. She's the president of Max Care. It's a support group for patients living with CML, chronic myeloid leukemia. I don't know if she's on this call.
Yes, she's on this call.
All right, thank you very much, Ma. You have the floor for the next 1 or 2 minutes.
Hello, can you hear me?
Clearly.
Perfect.
Okay, good evening, everyone.
Good evening.
My name is Eunice Oreka. I represent patients in Nigeria who suffer from chronic myeloid leukemia. It's a diagnosis of it's a blood cancer and a diagnosis where there is an issue at the bone marrow. I'm speaking with experts here, so I won't really go into details. But essentially, our group is one that was formed out of necessity. Incidentally, I myself also am a survivor. I was diagnosed in 2006, October 2006. where my diagnosis, as Her Excellency had mentioned, that many times, we don't know. And in fact, in my own case, it was just physical symptoms were the reason why I went to a hospital, and then the diagnosis was made. Incidentally, because I was quite fortunate, I believe, because the background that I have growing up, there are medical doctors in the field. So it was important that, oh, you're having some symptoms of being unwell, go to the hospital, and then it was diagnosed. But at the time I was diagnosed, it was really bad at the time, because then my diagnosis was made as accelerated phase. So chronic myeloid leukemia has three phases of diagnosis. It's either at the chronic phase, accelerated phase, or the blast phase. And I was diagnosed at accelerated phase. But as I was just very, very fortunate. My story is one that, it really resonates when I have to talk about it, because at the time that we were fortunate enough that there was an MOU that had been signed with the Obafemi Awolowo University Teaching Hospital, where we could receive drugs through the company that made it via an American foundation, and we could receive the drugs free. So treatments were free, and we could go to IFE and receive the medications. And that is how our own story is a bit different, because our own type of cancer is one that, over time, with science and innovations, as is targeted therapy. So I'm just giving that background to be able to explain the basis on which our group was formed. So at the time, as Her Excellency has also mentioned, cancer is a very isolating disease. I'm sorry, please, can you still hear me?
Clearly, ma, we are hearing you.
Very well.
Okay. So cancer is a very isolating disease. And as we all know, in these parts of the world, when you are given a diagnosis of cancer, first of all, there's fear, there's that feeling of isolation, there are different myths, there's stigma, particularly. And so people don't want to talk about it. People are just, afraid, and then just isolated. So at the time of the diagnosis, I was in the teaching hospital, I was receiving care, and by the time I started to improve while on medication, we just realized, the doctors that were my caregivers at the time realized that a lot of patients were coming in, and they needed that peer support, because they realized that even though the doctors will speak with them and all, many times the patients were not very responsive to them. They almost felt that the doctors are just doing their job. And so it was actually one of my profs at the time who approached me and said, why don't you use your story to encourage others? So what I would do is, incidentally, I lived in Ife at that time. So I would come to the clinic and then meet with fellow patients. And because I was doing well, sometimes the doctor would say, look at this lady, she's also doing well, why don't you speak to her? And of course, like the other speaker, Dr. I don't remember the name now, sorry, the person who made the presentation on Oncopadi, said that there's something about visuals that helps people receive comfort. And so seeing me physically was a bit easier, because I could meet a patient and she would say, are you sure? I say, yes, I'm a survivor. I'm taking my drugs, and I'm doing, and many times that will give that patient some encouragement. And so that was how our group was formed. Just basic, it was just born out of necessity. And we found out that it was very powerful. Just that peer support was very powerful. You could see people who would come in so bad, and we will explain to them, we will talk to them and just tell them, just be on the drug. We'll call them on the phone, follow them up on chats. And with time, we found out that our group was just growing. People would want to find about the groups. And then with the support of the caregivers in Ife, we established a WhatsApp group and a Telegram group. Now, one of the reasons why that's very important, and which is why when she mentioned about tools, it's important because, people find out information from different places. And if you're not careful, you can get the wrong information. And so what we did as a group was, after some time, based on knowledge and our doctors, and then information out there, we were able to come up with a patient information booklet. So what we did with that was most of the questions that patients would require or would ask all the time. You know, there are certain questions that patients would always ask. And the reason for this is that CML tends to affect more people within their reproductive ages. So we're looking at from about 14, 15, 16, 17, up to about 40, 45, 50. So we're still in the active reproductive phase. And so, of course, we know how it is in Africa. You have to have a child, you have to be reproductive. So we had a lot of women always, can I give birth? Can I have children? Will my husband marry me? And all of that. And so we compiled an information brochure, which we give at the clinic for patients who come. And that also helped a lot. CML Day, we have an international organization called the CML Advocates Network, who has helped to popularize and ensure that CML is a global, something that the global community understands. And so as a result of that, we have what we call the World CML Day. Now, it's celebrated on September 22nd of every year. The reason for that is that the defect where we have the issue of where CML occurs on chromosome 9 and 22. And so the translocation takes place at that stage where chromosome 9 switches with chromosome 22, and then the BCR-ABL is formed, which is what causes the CML. And so every year, September 22, we celebrate World CML Day. And so when our group was formed in 2011, we used to celebrate it at the teaching hospital in Ife, because that was where we were receiving treatment. So every year we would go on that day. We'll try to make it, if it's not a Thursday, because clinics is on Thursday, we'll ensure that we'll have it either the day before or the day after, but just to celebrate it on a Thursday. And so we'll have webinars, we'll have the doctors come and give us information. And because information is very key. Without information, many patients will die because you are not informed. And this thing about what you don't know cannot kill you. It's a lie. It's what you don't know that kills you. And so it's important. We emphasize that it's important that you are informed, you are knowledgeable, and all. And so we used to meet every year until COVID. And so after COVID, we now start meeting virtually. And so that's what we do. We have an active WhatsApp group, and it's very, very informational. We are very strict about the content. We don't, because of, you know how we can abuse social media platforms. So we ensure that it's only CML-related issues that are discussed there. And it has empowered a lot of patients. So just to conclude and just to say, just to bring my thoughts to a close, I really I'm grateful for this opportunity because, like Her Excellency also alluded to, there are too many silos. So we have a lot of people doing many things in different places, which are very laudable, but it's important that there's a platform where people can come together, and because people have, sometimes you just suffer one cancer, or sometimes people have multiple cancers. And so if there's a group where people can come together, be empowered, have this knowledge, it helps, because information is power. If you have information, part of the reasons why I can do what I do is because I have been informed, I'm trained regularly, and so I can provide knowledge for certain issues. When people say this, or when we say this, we know that, okay, no, this is the right thing, this isn't the right thing. So I just want to use the opportunity to thank the organizers of this event. Thank you to Dr. Monisi for inviting me, and I hope that this is something that we can continue regularly. Thank you very much.
Thank you very, very much, Mrs. Eunice. Well, you said a lot of things. I don't need to reiterate any of the things you've said again. I think I'll just proceed straight to one of the very few people I call my very big ogas, Dr. Uche Nwoku Emmanuel. He's the National Cancer Control Program. He's the National Coordinator of the National Cancer Control Program. I don't know if Dr. Uche is on the call. My ogasa. My Oga, I thought I saw him on the call earlier. Or he's probably not registered as a panelist, so he might not be able to unmute himself. Could that be the problem? Or I might also just be speaking to myself. Sorry, am I audible?
Yeah, audible. Yeah, I think it dropped, you know. It
Okay.
joined.
Oh,
I think it dropped. Yeah, we can make
I think
progress.
we'll just proceed. If Dr. Oche comes back before we finish this session of goodwill messages, we'll still call on him to give us a goodwill message. But I want to move on to another of the very big people I call my ogas. My ogas at the top, the DG of NICRAT, Professor Usman Aliyu Malemi. I don't know if he's on the call or he sent somebody to represent him from NICRAT.
I'm not sure it's here. It should be where they are eating dinner somewhere. In,
Oh
we
my.
are going to launch cervical elimination program tomorrow. So there is a welcome
No
dinner. So I think it
they
should
all
be there.
assured me they will be on the call. I will
Even
just
Her
move on.
Excellency Bagudu too. I think
Excellent.
she's the
That means
convener.
Her
They're all there
Excellency
eating
too is
dinner.
not. Oh, okay. Well, so many programs clashing. Well, since they are all cancer-related programs, we are happy. Cancer is making the waves as a topical issue. I think we'll move on quickly. And well, gladly is my co-moderator that I'll call on, Modupe Laja. She's going to talk to us about the BRANT program, Navigating Patients and Survivors. Modupe, I don't have to ask if you are on the call. Just take the mic and fire around.
Yes, thank you very much. Thank you very much, sir. Good evening once again, everyone. It's nice to be speaking with us today, especially about the BRANT program. I'll be going over what the BRANT program is for us. The BRANT program stands for Breast Cancer Access, Navigation, and Testing Program. I'll be speaking to us on how this helps in navigating patients and survivors. And just to explain, I am the project manager for the BRANT program from Oncopadi Technologies. The BRANT program exists to solve a problem. Every year, over 32,000 Nigerian women are diagnosed with breast cancer. You would agree with me that breast cancer is the most common cancer among women, and it also has the highest mortality rate. With this high mortality rate, there is a key factor behind it, and that is the lack of access to immunohistochemistry testing. This testing is a crucial tool in knowing the type of breast cancer a woman has. And this is important in coming about tailored treatment plans. And this is one tool that is very important, very crucial for healthcare practitioners. However, this gap in access to care keeps widening because of the emotional distress that women newly diagnosed with breast cancer experience, because of the stigma that these women face, which has also been mentioned earlier during this call, and also the limited supportive systems. When speaking with women newly diagnosed with breast cancer, what usually comes about when speaking with them is they're usually alone. They don't have many people that they can depend or rely on. They're scared to go out. They're scared to tell someone about it. They feel sad. They feel anxious. They feel overwhelmed. And so this increases the fear and the isolation that these women face. And so this is why the BRANT program exists. The BRANT program is a 12-week digital navigation program co-created by Oncopadi Technologies and Roche Nigeria. The BRANT program has a goal to support newly diagnosed women with breast cancer, 5,000 women, to access timely immunohistochemistry testing that ensures that they have access to the type of breast cancer that they have and can start on their tailored treatment plan as early as possible. Each woman registered on BRANT has a dedicated account and an assigned patient navigator. The BRANT program is based on 3 pillars: access, navigation, and testing. When we talk about access, one of the things we talked about earlier during this webinar is about misinformation, about how women newly diagnosed with breast cancer are always eager to find out what exactly is breast cancer, how did they get it, what are the risk factors, what should they do next. And so through this program, we provide access to patient educational resources such as videos. There's also access to the nutritionist. We also have access to the counselor. Under the navigation, each patient gets assigned a patient navigator. Now, the patient navigator is someone that will support the patient on their brand journey, that will help them know that this is where you are at the moment, this is where you need to be, so that they don't feel so alone, they don't feel so confused, they feel guided on their journey. The brand program also has the tumor board review, where a team of specialists come together to review the report and give a tailored treatment plan. And there's also access to the post-care platform developed by Oncopadi Technologies to help in monitoring side effects. And then the third pillar is testing. Free immunohistochemistry testing. We understand that this testing is not so accessible and it's not affordable. Ranging from 100,000 to 200,000 naira, it is expensive for a lot of women. They cannot afford it. And so this program exists solely to support these women. And so the brand program is a journey. When patients are identified to gain value from the brand program, which means that they have confirmed histological reports, they are referred to the brand program. And when they are referred to the brand program, they are assigned a patient navigator. Through the patient navigator, they are supported to be enrolled on the brand platform. They get access to the educational videos that they can watch to learn more about the videos, to learn more about breast cancer. And then we have the consultations where they can speak with the nutritionist, they can speak with the psychologist. And then you have the free immunohistochemistry testing, where the tissue blocks are sent for the test and returned back. The reports are also shared with the patients. Then is the MDT, and then we have the program reports. The brand program was launched on March 13th at NICRAT in Abuja, where we had a number of people in attendance, both physically and virtually, a total number of 146. In the first month of the brand project, we had 54 women who were eligible. We had 34 who were signed up on the platform, and we had 27 requests for immunohistochemistry tests. To be a part of the brand program, we need to understand that women newly diagnosed with breast cancer is the focus of the program. And these women have confirmed histological reports saying they have breast cancer. To refer them, we have a referral link that will be dropped in the chat. Anyone could fill this referral form to share that there's a particular person that can benefit from this program, and our team will reach out to them. Or if you know anyone in the team, you can reach out to us and would also reach out to this person to onboard them on the program. You can spread the word about the brand program and how it's providing free immunohistochemistry testing for newly diagnosed women with breast cancer. This brings me to the end of my presentation on the brand program, and I am open to any questions that we have on the program. Thank you. So at this point, I would like to ask if we have any questions. We can put it in the chat and I would respond to the questions. And would also have the referral link in the chat so that if we have anyone who could benefit from the program, we can refer this woman. So I'll be giving a couple more seconds in case we are trying to type. Thank you very much. In case we're trying to type our questions so that we can respond to any. We'll also be dropping the link to our website in case you'd like to know more about the brand program. You can also check out our website for more information. In absence of any questions, I will be inviting Professor Abidemi Omonisi for the unveiling of Nigerian Coalition for Cancer Survivors. Thank you very much, sir.
Yeah, sorry, before Prof comes on, I just wanted to inform the House that there would be pictures at the end of the whole event, or just after this, after Professor Abidemi, after Mr. President does the unveiling of NCCS, there will be taking of pictures, group pictures for the records. I just noticed that somebody is saying they're already on their way out of the call or something. So please, those of us that can wait, please, let's try and wait. Sorry, Mr. President, for interrupting you. You have the floor, sir.
Thank you very much. I must sadly thank Her Excellency for that excellent keynote address, and also thank Mrs. Eunice Oreka, the president of Max Foundation. I intentionally invited her, to this program because that group have done excellently well. I had my postgraduate training in Ife, and I know that Professor Moise Drusimi was very instrumental in the treatment of CML in the country. Patients come from all over Nigeria to Ife to access the drug-free. There was a time they ran into issue with NAFDAC, and getting the drug was very problematic. But because of that group, the group was able to engage NAFDAC and also get that issue resolved. So having a coalition of cancer survivors is necessary, because what you would do on your own, once you have 2 or 3, you join forces, you get it done better. Matter of fact, some of the members of that coalition were actually highly connected. They were able to talk to people in government, and that issue was actually resolved. So that's some of the benefit that we'll have. The Nigerian Council, as I've said, we are taking it as part of our responsibility to organize an enduring coalition. There are several attempts in the past, that have failed. I think about 5 or 6, just few individuals just come together to form a coalition, and the base is not known. Very senior people were not carried along, and it's very difficult for people to identify with the process when they were not consulted. That's why we think the NCS should have a coalition that is national. We're not taking over the various support group. Already there exists a support group in the country that will continue. But we need this coalition backed by NCS to monitor the activities. Even the individual support group, people are doing different things in different places, because I've visited some support group. That's what they are doing. There's no uniformity, there's no information sharing. People are just operating their own silos, which we think is also not correct. Some also use the opportunity to expose our members, our survivors, some unethical, research, which is actually not too good. I have a platform to discuss that issue that we must be well guided. We can't just coalesce people, bring people together because we want to give them support. The next thing, you link them up with researcher, and the next thing, they take their blood and ship abroad, helicopter science. Those nonsense must stop. People are not guinea pigs. And that's why once we have this ESCO, we make sure we work very closely with all the support group. And no researcher will come from abroad and just come and coerce people, give them naira, take their blood, take their biopsy and take it abroad. We won't condone that kind of nonsense. I've told you, we must do everything possible to fight helicopter science. We are not saying people should not be part of research, but due process must be followed. Ethical issues must be considered. People must be well educated, and they must sign consent. They must give consent. Not that on these guys of no consent, nothing. Biological sample have been shipped abroad. So we need this coalition. Most importantly, we say we have an ambitious plan of sourcing 100 billion, 100 billion in the next 5 years to support survivors. What we have going on in the country is national disaster, where we have survivors cannot afford their medication. And interacted some of them few days and few months ago. They say, Mr. President, we are surviving on prayer. say we cannot afford the medication. They are too expensive. That even their brother, their relative have been supporting them. Everybody fatigue are setting. The National Cancer Aid Fund, being run by federal government, issues with that. That's picked up now, but that really does not cover cancers. So we are determined, to set up our own cancer fund. And as I've said earlier on, we're going to select, we move beyond the tunnel now, and we think that will work. And we need this coalition, because, we need a body like that to advise the governing council. Of course, the president on the board, but, it's not something that people will decide for them. It should be bottom-up decision. The coalition leaders and the coalition member will decide, this is what we think, we want. The council will look at it and decision will be taken. And if there are issues with the fund, the coalition, can serve like a watchdog, sure check and balances, in running of the fund. As I've said, ESCO will not be part of it. As the president, I have no saying. The council will decide, they will manage, and they will administer. We'll just keep an oversight to ensure that things are done accordingly. So based on that and due consultation, we'll be setting up a coalition for our members. And yes, Dr. Oche, sir, will allow you to give time. Thank you, sir, for coming back. And we want a name that anywhere the coalition stand, it will fly our country. We don't want a name that we cannot identify. Like a Nigerian Cancer Society, there's nowhere we'll get to. Nigerian Cancer Society, they know we're from Nigeria. So that's why, the NEC has agreed that we have a coalition called Nigeria Cancer Survivor, Coalition of Cancer Survivor, NCCS. And the coalition will be chaired by no other person after due consultation. What we have done is to create offices that will cover the entire geopolitical zone. So each zone is represented, at the national committee. We'll make consultation on the advisory board. There'll be an advisory board made up of very eminent cancer survivor, very senior people. That the national committee will report to. As I've said, all members of the national committee and also advisory board are cancer survivors. We don't want people to decide for them. By the mandate of NEC, I have the privilege to announce to you that the pioneer national chairman, for Nigerian Coalition for Cancer Survivor, is not that person than Professor Ronald, Bejide. He's from Southwest. He's a professor, of laboratory science, in Ondo State. Has given consent. Prof, are you on the call? Can you show your face? If you are not in the other room, can you show your face so people can see you? Modupe, is there a way you can track Prof? You see, yeah, yes, excellent.
I'm here.
Okay, we're not seeing your face, Prof.
Okay, let me see. The video is not showing.
Okay, if it's not showing, that is fine. We'll allow you to give your acceptance speech thereafter. Thank you very much, Prof, for coming. So, Prof is the pioneer national chairman. We need someone very cerebral, because we don't want people that will get there and think we are joking. We are not joking. It's a very serious issue when it comes to the issue of survival. It's one of the major pillars of my business. So we need somebody very, very cerebral that will help us, organize that coalition. It must work. This time around, it must work and it must succeed by the grace of God. So the vice chairperson is from Northwest. We try to also be gender sensitive here, and it's our Kwakudu. I don't know if she's around. Northwest, she's the vice chairperson. Then the secretary goes to Southeast. Ugo Mercy. Mercy, are you on the call? The North Central, we have the Assistant Secretary General, Salami Miriam, Assistant Secretary General. Then we have Solomon that is the Assistant Secretary General, yes. Then for the, we are still expecting the nominee from South-South. South-South, we actually zone Financial Secretary to South-South. That will be, I think, communicated to us subsequently. And Northeast, we are zoning the PRO to Northeast. And Sabina Solomon is the, PRO. So that is a member of the National Committee, for the Nigerian Coalition of Cancer Survivor. And at this point, inaugurate the committee led by Professor Roland Bejide. So on behalf of the Board of Trustees and on behalf of Nigerian Cancer Society, especially the NEC, National Executive Council, I hereby inaugurated today, Monday, 2nd June 2005, as a pioneer national expo of the society. We wish you all the best. We are open for discussions and also support. Feel free to reach out to us. The NEC will give you all the in-depth support. In a few days ahead of us, we'll consult with our leaders and have an advisory board. I can assure you to work because we're experimental with Youth Coalition Against Cancer, and we're very proud of what they are doing. We can say now in the entire country, all the states in the country and Abuja, we have coordinators for youth. We have youth. And our discussion with the Minister of Youth now is for us to organize the very first coalition national meeting, youth meeting, that will be taking place, later this year. So we're also looking forward the time that we also organize a national summit for cancer survivor. We'll get there. So we wish you all the best. So let me just pause here to allow Prof. Roland Bejide, made acceptance speech on behalf of the team. Over to you, Prof. Professor Roland, are you able to speak? Go ahead, sir. You have, yes. Okay,
Thank you.
Go ahead, sir.
Yeah. Thank you, my president and the president of National Cancer Society of Nigeria, Professor Abidemi Omonise, for the opportunity given to me to serve and our teammates, and we pledge our support. Apart from we being a survivor, we know what it takes. But this is a laudable mission, and I think it's a project in the right direction for our country and for generations to come, and to uplift the image of cancer treatment in Nigeria. We promise to do our best, to the best of our knowledge, not to fail all the promises made. With no time, we shall not waste any time to set the ball in motion, and we put up all our mechanism to work, and then to make sure that coalition in Nigeria is well reformed, and then we can collect our efforts to make meaningful impact at the national level and globally. In a nutshell, I would say thank you once again for the opportunity given to serve, and we do our best not to disappoint ourselves and God and the nation at large. Thank you. God bless you.
Thank you very much, Prof. Thank you, sir. All the best. We are sure of support. Give all the support. You succeed. The youth have succeeded already. We'll do everything possible by the grace of God to assist you. Thank you very much.
Thank you.
Okay, our boss at the top is there. So I guess you speak for yourself, also speak for the minister, and speak for the Ministry of Federal Minister of Health. Over to you, sir.
Okay, I don't know if you can hear me now. Good evening.
Clearly, sir. Clearly, sir.
Okay. My own capacity president of the Nigerian Cancer Society. Your Excellency, Dr. Betty Nwakaredolu, one of the greatest champions of cancer in Nigeria, and all the stakeholders here. Please permit me to align myself with any protocol as established, as I'm not able to go through to identify all those who are here, but I'm very sure that so many eminent oncology stakeholders are on the call. And special tributes to Oncopadi, the People's Oncologists. I really enjoyed your presentation. And the president of the Max Foundation, who happens to be a partner because I'm one of the hematologists that manage in Ife. And then all the people that has leukemia that we managed while I was in Ife for 5 years. I bring you special greetings from the National Cancer Control Program, Federal Ministry of Health and Social Welfare. And I think I want to start by saying that this is a novel initiative of the Nigerian Cancer Society, led by Professor Abidemi Amonisi. And I just want to start by saying that, please, I hope this becomes at least or at the least a quarterly program, if it can be monthly program, because the patient is actually the center of every single thing we do in the oncology space, whether policy, research, treatment, and all of that. Everything we're doing is around the patient. So when we have champions who are called survivors, then they should be celebrated at all times, and it gives us opportunity to review what we are doing as stakeholders in our various circles, to be sure that what we are doing is making any impact at all, is when we engage in programs that involves survivors, because they will share personal experience, and then we'll be able to learn whether what we're doing is making impact or not, whether in terms of policy, in terms of research, in terms of diagnostics, in terms of treatment, and survivorship, of course. So I want to commend the NCS for this initiative and all the partners for this. And on our part from the Federal Ministry of Health, everything about the National Health Act confers on the Federal Ministry of Health with the power to make policies, programs, and guidelines for the Nigerian health sector. So for cancer, it is our duty as a National Cancer Control Program to ensure that relevant policy directions are developed and implemented for the Nigerian cancer space. And we cannot do that without engaging stakeholders like the NCS and the champions. Okay, so we're hoping that we'll continue to leverage on what we're doing on this partnership to be able to make policies that are implementable, policies that should influence how good or how well our patients should be managed for the desired optimum outcomes. So I want to encourage you not to relent on whatever we're doing, but for us to work together as a team. Because I believe that when we work together as a team, all the necessary lessons, all the necessary efforts that we made will now be made as a team, and all of us shall, at the end of the day, be happy, because we are going to have more of our people joining this kind of programs to share their experiences. I was particularly impressed with the experience shared with the Max Foundation person, because of course then in Ife, before the advent of Glivec, CML was also like a death sentence. Okay, so before Glivec was invented, once somebody is diagnosed with chronic myeloid leukemia, the person is as good as gone because the treatment at the time was not effective. But when Gleevec came on board, you can see people living virtually their normal lifespan because they're able to live on a drug, though very expensive, but the Max Foundation was able to key into the cheaper program of the Novartis. And as of today, I'm aware of some of our patients who are over 20 years old with leukemia, with CML. Okay, and so many other cancers now have their own targeted therapies. Breast cancer has a targeted therapy, just like so many other cancers. So we're hoping that the people in the research space should be able to identify medicines that can make virtually every kind of cancer to have targeted therapies that can prolong the life of our citizens and then take away the death sentence that is handed over to them at the point of diagnosis. So we're also hoping to partner with every stakeholder, including brands. Brands has also come to provide early diagnosis with immunohistochemistry to be able to have optimal treatment for our patients. So, for Minister of Health, today we're able to pass the memo making IAC mandatory for all cancers in this country as long as they will benefit from targeted therapies. So I passed that memo, and I'm hoping that a circular will come from the Minister and the Permanent Secretary managing our hospitals to key into that project. I'm sure that cannot work if we, as stakeholders here, do not buy into it. And that's what we need to do as the Ministry of Health, to give directions on how we need to manage our cancers. So thank you, everyone, for being part of this, and I hope that it will be the beginning of greater collaborations to come in the future. Thank you, and God bless all of you.
Thank you very, very much. My own very big Oga, Dr. Uche, the National Coordinator, NCCP. Thank you very much for the goodwill message. We will be taking pictures soon, but I think everyone would have to eventually be made a panelist for us to be able to put on our videos and take pictures. So while that process is going on, today we'll be rounding up the activities about the National Cancer Survivors Day 2025. We do not play with our survivors, through needles and nausea, through their silence and tears. These are the people that battle with strength far beyond their years. We want to call on Mr. President again, Professor Abide Monisi, to handle the closing ceremony for the 2025 National Cancer Survivors Day before we make announcements, take pictures, and the vote of thanks. Mr. President, sir.
Yeah, thank you very much. Just to say that we started the activity on Friday, and Saturday, Friday, there was arrival, there was courtesy visit. Saturday, there was walk. Friday, also, there was also Jumat prayer at the National Mosque in Abuja. Saturday, there was walk, cancer walk. Then Sunday, there was, we had Thanksgiving and also lectures, 2 major lectures, one in Lagos, another one in Akwa Ibom. And today we have a keynote lecture from our mommy to wrap up this session, and also inauguration of the National Nigeria Coalition for Cancer Survivor just a few minutes ago. We've done well, and with this, we'll continue the advocacy. Unfortunately, we're unable to announce the governing board. I'm happy Dr. Uche is there, the National Coordinator of NCCP. He has gladly accepted to serve as the Vice Chairman of the Council. As I've said, of course, Dr. Uche is the brain behind the current HCA. They've changed it now. It used to CHF, now NCHF. He put the document together, formed the committee, and Prague was able to fund that. And now that I moved to NICRAT, we are grateful that he's not tired of serving cancer survivor. He has, accepted to serve as the vice chair. So with that, we are very confident that the National Cancer Independent Fund will survive because we have, the brain behind it. The chairman of the council is also a global financial expert that have been very useful. He has assisted federal government to bring him many grants. Work very closely with Professor Ali Pate, the Minister of Health. When it comes to global health and global funding, is well known. He has also gladly accepted to chair that the committee. He also bringing in his colleague from Nigeria Governors Forum, and also the organized private sector. So we're also bringing in a lawyer, commercial, firm from Lagos, to also be part of it, and that is the next, vision and project for us that we're going to pursue for the survivor. We cannot continue to sit down as a responsible society and watch people say they depend on prayers, that they hope in God. We believe in God, but God also gave us the wisdom to also apply science. So as people pray, let them take medication, let them go to the hospital. So we're going to do our best to support our cancer survivor, so that those that have stopped their medication, they can get back onto it. But officially, we need to put a pause to the various activity this year so that we can carry on. But the background, continue to consult and also work for the survivor. So by the power bestowed on me by our constitution, I therefore declare close the various activity that were a landmark for the successful conclusion of this year. We sincerely thank Almighty God for the journey mercies. Our team that went from Abuja to Uyo, they are back. I can see the vice president of the call came back to Abuja earlier today with Dr. Ishak. They went there to represent the society. Our other team also in Lagos, they're also in Abuja now. And all the various activities that will line up, was very successful this year. Although we are starting very small, but now next year, I'm sure we do, better. Now that we have the National Coalition for Survival, they will take the lead. We will give the support. So we have a year to plan. And we're also hopeful that in 2026, God willing, 1st of June, our Cancer Intervention Fund will have started. Not only that, patients, cancer survivor, patient, the hospital, and also a cancer survivor will have accessed the fund so that we're able to assess ourselves, progress made. So on behalf of the council, I want to really thank everyone. Let me start with Her Excellency. Thank you very much, Amomi, for accepting to be our keynote speaker. We also thank those that traveled to also give various talks. Dr. Ishak Lawa, gladly accepted to be part of the team that traveled to Uyo. They were there, he gave lecture, was the keynote lecturer at that event. The vice chairman was there, president was there, Dr. Chika Dibia, to represent me to flag off the event there. Thank you so much. Everyone have sacrificed in one way or the other to make this event amazing. Let's continue to pray for our survivor. Let's continue to reach out to them in our own capacity. And most importantly, some of them are out of job, those in private sector. We're working hard, with government agencies to see how to fix them. But I've discovered at NEC that it will start with NCS. We cannot be running Nigerian Cancer Society and there is no survivor working as a staff. I've discussed some of them that our next meeting we're going to discuss and create a position, in this NCS for a survivor. That is the only way we can show that we are responsible. We're going to create a position, we're going to advertise, to be for a survivor. That survivor will be employed and be part of our staff at the secretariat to be on their salary. We also reach out to our guy, the Minister of Health. I'm happy Dr. Uche is still on the call. We'll work with Dr. Uche to see how the ministry can also absorb some of the survivors to work in the SCCP. I'll reach out to the NICRAT also. We can't have a big cancer institute there will be no one single survivor working there. It doesn't make sense as far as I'm concerned. just we must have a survivor working there, because coming talking about cancer and the survivor not carry on. So we do our best to fix in our survivor, not only calling them to meeting or taking them to television to go and share their story. Beyond that, those that are unemployed, let's do something to put them to employ them. Once they employ and they receive salary, no matter how small, they can support themselves. So NCS is leading the way. We are creating a position for a survivor. I'm going to employ and place that person on salary. So we expect that NCCP and also NICRAT, to also follow way. We also reach out to our researcher. We know people that have grants for research. Any research you are doing, you must employ survivor scientific officer. You can do scientific work just to gather data and study computer. You place the person on salary. You can't be doing research on cancer and the survivor are unemployed and they are not part of it. You can't employ other people to work on it. We work with our researcher also, Professor Latishe Nife and other people that have Solomon wrote in Kenala, in the Covenant University. We know people that have grants, on cancer. Let them employ some of our survivors as research assistants. That's the only way we can mop out, this employment rate, among them. So once again, thank you very much for being part of this webinar. And wish everyone a nice evening. And thanks, Anova.
Thank you very much, sir. Thank you very much for all that you have said about the 2025 National Cancer Survivors Day. It has been an eventful occasion from the time we started till now. And at this point, I would like to call on Dr. Tessie Amadu for announcements for NCS. Dr. Tessie Amadu, over to you, ma.
Good evening, everyone. Thank you for joining. And I want to stand on the existing protocol. Here are some few announcements from the Nigerian Cancer Society Secretariat. The first edition of the town hall meeting will be holding in July. The dates will be communicated before then. There's also going to be the launching of the cervical cancer elimination by Her Excellency Senator Remi Tinubu tomorrow, being Tuesday, the 3rd of June, 2025. And NCS delegation would be in attendance for that event. Also, the inauguration of the YOCAC state coordinators, the chair and co-chairs of the various committees and the international chapters will take place later this month. The date will be communicated accordingly. The first YOCAC National Youth Summit will take place tentatively on the 6th of October 2025. So preparations would soon kickstart. And lastly, we want to announce to members that the NCS National Secretariat is now fully functional, and we ask that members who visit or who are in town can visit the Secretariat whenever they find themselves around in Abuja, support and encourage the vision of this of the Abidemi Omonisi's administration. Once again, we want to say thank you for everybody that joined this meeting and stayed waited patiently till this time. We bring goodwill from the National Secretariat of the Nigerian Cancer Society. Thank you very much.
Thank you very, very much, Dr. Tessie Amadu. And I want to thank everyone that has actually been patient, just like she said, and waited to this point. We just have one major activities before we take our pictures, and that is the vote of thanks, very important aspect of the program. I want to call on Dr. Aisha Mustafa. She's the co-chair. We actually have two chairmen for the NCS, Training and Capacity Building Committee. I'm one of them. She's my co-chair. So Dr. Aisha, please, I will need you to help us take the vote of thanks. Thank you.
Thank you very much, my chairman, Dr. Samuel Otene. Thank you, everyone that have joined this webinar and have stayed till the end. I want to thank all our teachers, our leaders in the Nigeria cancer space, the
We lost her. Or is it mine? Network. Dr. Aisha, you see her?
Yeah, I think we lost her.
I think we lost
Network. Okay, she's still trying to link up.
tenure has been a very good work.
Okay, Dr. Tene, maybe you can just give vote of thanks on our behalf so that we can take a picture.
Yeah, okay. Thank you very much. No, I think she has done, at least I heard her thanking everyone on the call. I heard her thanking you, Mr. President. I heard her
Really?
thanking
Okay.
everyone that has made today's meeting possible. So I think I will consider that the vote of thanks have been taken. And thankfully, Mr. President took some aspects of vote of thanks even while he was giving his own, while he was giving the closing, during the closing ceremony for the 2025 National Cancer Survivors Day. So please, I think right now we should put on our videos. We should be able to put on our videos so that at least we will get pictorial evidence of this meeting. It's our inaugural meeting for, it's our inaugural webinar. Dr. Uche has requested that we meet at least quarterly. I'm assuring we are going to be doing it on a 2-monthly basis, is bi-monthly, and we'll be bringing lots of other interesting topics, not just on cancer survivorship, but on so many other areas related to cancer oncology, so that we'll keep updating our knowledge. I am telling others to put on their videos. Mine is not up yet. So yeah. Who is taking the pictures? I think Modupe is going to be doing that.
I can't see the video icon. Oh.
Dr.
Really?
Tene, we can't see the video icon. It's only for the.
I can't see the video icon.
So no. You see, I think they are trying to add everybody to become panelists. Modupe, I think you are on it.
Yes. That's what we're trying to do at the moment.
We're
sending panelist invites to everyone.
Okay, you sent invites to everyone.
Yes. So we just need you to accept the invite.
Everyone will.
Where are they accepting it? Is it in the chat box?
No, it will pop up on their screen.
It will pop up on the screen, then accept and say panelists, which I've done.
Yeah, I've done that too. So I'm
the
there.
number of attendees is reducing, and the number
We
of
haven't seen that.
So please, Modupe, maybe you keep sending.
Yes, we'll send again, sir. We'll send again.
Yeah, but I am seeing the numbers are changing, so that means we are making progress.
But Dr. Tessie, is able to speak? That means you have accepted. You're a panelist. So you can.
I can't see any icon. I can't see any icon.
No, I think Tessie was unmuted.
You see, you quickly on the video.
I think Tessie was muted by a moderator, because I can't see her on the list. Okay, yeah, she just became a panelist now. Like I said, the number of panelists is increasing, the attendees are dropping, so everybody will soon be on the video.
I've got the invite. I've joined.
I can see your face right now.
Welcome.
My chief, Ogachi Kadibia. Good evening, sir.
Well done. Good.
So officially, the program is ended. It's just the pictures we are waiting for. So it means we can actually greet each other as we go along now. Just hoping everyone would. Why are the panelists increased? Okay. Oh, yeah. We have just 16 more people who have not accepted the invite.
Professor Monisty, where are you? I like
I
that background. Where are you?
am seeing my yoga president. And Your Excellency, I don't know your face.
This is fake. I was wondering. I thought you were in Mauritius.
No, ma.
Because I'm seeing the beach behind you.
Honestly, such a beautiful scenery. I love it.
Thank you, man. That's the power of technology, man.
We now have 30 panelists. We have just 13 more people. We are waiting for 13 people to accept.
But we're sending the invite. So for those of us that might not have seen it, you'll be seeing it again.
Chief Otene, well done. No? Good to see you and to hear your voice.
Excellency, good evening, ma. It's good to hear your voice, ma.
Modupe, let's know when you are ready for the picture, please.
Yes, ma. The numbers of
there are
attendees
now 11 people. We are waiting for 11 more people.
Yes. So please accept the invite when you see it on your screen.
Or maybe some are not ready.
Yes, there's also.
They might be in the other room. I don't want us to see their face.
So I think we can start.
Okay, all right, we'll start. So please do look straight at your camera and smile so that we can take the pictures. Thank you.
I didn't receive any invite.
Okay.
Well, you can take again.
All right, ma. We're taking again. Please give us, we're a number of us, that's one. Let's please hold on. Just hold on. Please hold on. Please hold on. I see a lot of lovely faces.
Hope you can see my teeth.
Let's just hold on.
We are still stuck on the 11.
You can light a candle. You don't have lights.
I didn't receive any invite here, please.
Wow. Modupe, maybe we'll just take 1 more minute to just send the invites round. Since it's just 11 people, it'll be easier.
Okay.
Sorry.
Mr. President, I see in Abuja.
Sir?
Hey, see my Gaucho. Well done, sir.
Okay, if you don't have light, put on a candle.
On Zoom meeting. I don't have light. Tell me, I have got this.
Light the candle. We can see your face now. Good.
We don't have light. That's right.
It's okay. We can see you.
Okay, 2 more have joined. We just have 9 more.
We're not seeing your face again. No?
I deliberately switched it off for now. Okay. Bringing it back. I am back.
All right, so we'll continue taking the pictures.
Yeah, I think, okay, we have been taking the pictures, right? So we can just continue while this.
All right, thank you so much, everyone, for supporting.
Thank you so much. I hope we have caught Dr. Oche's face before he disappeared.
I didn't receive any invite here, please. I see any invite.
Wow.
Hello.
But yes, sir, we can hear you, sir.
There are
Okay.
7
I'm
more
coming. No invite yet.
So I think we'll do 7. 6 more people. No. It will be nice to capture everybody's face, really.
Yeah.
Ma'am, you are a panelist. Please turn on your video, ma. Please turn on your video, ma.
Okay.
Yes, please.
I think I'll do.
Okay. Yes, we can see you now.
Thank you. Good
No, I
evening.
didn't.
Just 6 more people.
They are capturing pictures for attendance.
Lara Adelegan, Tinu Lawal, Tofik
Sorry,
Tokpe.
what if they are not in the meeting? We will continue to wait.
Okay, so I think maybe they are just switched on, but not here.
No,
I
the
think
picture of Tinulawa
pictures
is
have been
okay.
ongoing.
She has the covering picture,
Yes.
Dr. Yuba, so that can serve. Yeah, that's on that way to,
Okay.
Yeah.
But the pictures, I think the pictures have been ongoing.
Yes.
Modipe has
Yes,
picture.
yeah.
So I think I'll call it a day, not to keep Her Excellency waiting.
Yes,
almost 9 o'clock. Yeah. Yeah.
But the program was shared.
Thank you so
Nice
much, ma'am.
meeting. Nice meeting
Thank you.
all of you virtually.
Thank you
so
so much,
much,
ma.
ma.
Thank you, ma. Thank you so much,
Thank you,
ma.
man.
Thank you, ma.
Keep it up.
Thank you, ma.
you.
Thank you,
Very
ma.
good night's rest.
Bye.
Good night.
Bye.
Dr.
Bye.
Salako, well done.
Bye.
Oh.
Bye, ma. Thank you, ma. Esra. Thank you.
Dr. Okunubu is saying hello, Mao, from Akure.
Dr. Okunuga, I was excited when I saw your face too. Well done, ma. Good night, everyone.
Good night,
Good
everyone.
night.
Thank you.
Good night.
You're a great
All right,
star.
bye. Bye, my president. Bye-bye. See you.
Well done, sir.
Bye.
That's it. Good night.
Good night.